Last week, I received a letter from John, a 65-year-old retired teacher, sharing his struggle with something many men face but rarely talk about: erectile dysfunction, ED. John isn't alone. In fact, studies show that nearly 52% of men aged 40 to 70 experience some form of ED. It's a challenge that can feel isolating, but the truth is, you're not alone. ED isn't a sign that everything is falling apart. It's a common part of aging, and there are real, proven ways to manage it. In this video, we'll dive into medically backed solutions, lifestyle changes, and simple strategies that can make a world of difference in restoring confidence and intimacy. Before we get started, I'd love to hear from you. Drop a comment below telling us where you're watching from, and don't forget to like, share, and subscribe for more helpful tips. Let's get into it. Now, let's break down how erections work and what changes as we age. Understanding how erections work is crucial to understanding why they may not happen as easily as they once did. Essentially, an erection is the result of a complex process involving the brain, nerves, hormones, and blood flow. When you become sexually aroused, your brain sends signals through nerves to the blood vessels in your penis, instructing them to expand. This allows blood to flow in, and the pressure traps it there, creating an erection. It's a delicate balance of physical and psychological factors, which is why any disruption in one part of the system can affect the whole process. As we age, certain changes naturally occur in this system. For example, blood vessels become less elastic, making it harder for them to expand and contract as needed for an erection. Hormonal shifts, such as a decrease in testosterone, also play a role in reducing sexual desire and performance. And while these changes are part of the aging process, they can be exacerbated by health conditions like heart disease, diabetes, or high blood pressure, all of which affect blood flow or nerve function. A study by the Mayo Clinic found that men with chronic health conditions are more likely to experience ED, and it's a condition that tends to worsen with age. Dr. Mark McAllister, a urologist from the University of California, emphasizes that ED is not just a sign of aging, it's often the first indicator of a deeper health issue, which is why it's essential to see your doctor. This highlights the importance of addressing ED, not just as a physical concern, but as a signal that could lead to better overall health. Remember, you're not alone. ED is a common issue for many older men, and it's important to normalize the conversation around it. In fact, it's estimated that more than half of men over the age of 50 will experience some form of ED at some point. Recognizing that you're part of a larger group can help remove the stigma and open the door to practical solutions. Now that we understand the basics of how erections work and how aging and health conditions play a role, let's dive into the medical insights that can shed light on the specific health issues contributing to ED. When it comes to erectile dysfunction, ED, several common health conditions can play a significant role in disrupting the natural process of achieving and maintaining an erection. One of the most important factors to consider is heart health. Poor circulation, which is often linked to heart disease, can affect blood flow to the penis, making it more difficult to get an erection. Conditions such as high blood pressure and atherosclerosis, plaque buildup in the arteries, are particularly concerning, as they directly limit the amount of blood that can reach the penis, which is essential for achieving an erection. Diabetes is another condition that often contributes to ED. High blood sugar levels can damage nerves and blood vessels over time, making it harder for the body to respond to sexual stimulation. It's not just the long-term effects of diabetes that are problematic. Even borderline diabetes or prediabetes can contribute to erectile difficulties. This is why managing diabetes is crucial, not just for general health, but for maintaining sexual function. Medications, particularly those used to treat high blood pressure, depression, or anxiety, can also have side effects that contribute to ED. Many commonly prescribed drugs, such as antidepressants and blood pressure medications, can interfere with the hormonal and blood flow processes that help with erections. It's important to talk to your doctor if you suspect that your medications are affecting your sexual health. They may be able to adjust your treatment plan or suggest alternatives that have fewer sexual side effects. As new medical guidelines on ED are continuously being updated, it's important to follow the latest recommendations to ensure that you receive the most effective care. In the United States, the American Urological Association, AUA, and other professional organizations have developed guidelines that recommend a thorough evaluation by a doctor if you're experiencing consistent ED. This typically includes a physical exam, blood tests to check for underlying health issues like diabetes or hormone imbalances, and an assessment of your medications. It's crucial to consult with your healthcare provider to get an accurate diagnosis and to explore the most appropriate treatment options. If you're over 65 and dealing with ED, it's also important to know that many seniors are covered by insurance plans that include treatment for erectile dysfunction. Medicare, for example, often covers some aspects of treatment, including consultations and medications like Viagra. However, certain treatments may not be fully covered, so it's essential to check with your provider and discuss options for managing costs. Take Bob, a 70-year-old from Florida, for example. Bob had been struggling with ED for a few years, but he didn't realize how much his heart health was contributing to the issue. After visiting his doctor, he was diagnosed with high blood pressure and prescribed medication to help manage it. Bob's doctor also suggested lifestyle changes like improving his diet and exercising more regularly. With these adjustments, Bob noticed a significant improvement in his sexual health, and his ED symptoms began to subside. His story is a testament to the fact that ED can often be managed or improved by addressing underlying health conditions and seeking proper medical advice. Now that we've covered the medical insights behind ED and why seeing your doctor is so important, let's turn our focus to lifestyle solutions that can help reduce or eliminate ED. When managing erectile dysfunction, ED, lifestyle changes can make a significant impact. Exercise, in particular, is one of the most effective ways to improve sexual health as it enhances circulation, boosts energy levels, and helps maintain a healthy weight, all factors that contribute to better erectile function. For seniors, the key is to focus on safe and moderate activities. Walking, swimming, and cycling are excellent low-impact options that can improve cardiovascular health without putting unnecessary strain on the body. Strength training, when done correctly, can also help with overall stamina and hormone balance. Studies show that men who engage in regular physical activity have a much lower risk of ED. In fact, a 2020 study published in the Journal of Sexual Medicine found that men who exercised regularly had a 30% lower risk of experiencing ED. Diet plays a crucial role as well. A diet rich in whole foods, vegetables, fruits, and lean proteins can support overall health, while processed foods, excessive sugar, and unhealthy fats can exacerbate ED symptoms. For seniors, adopting a Mediterranean diet has been shown to improve not only general health, but also sexual function. The Mediterranean diet, which emphasizes whole grains, healthy fats like olive oil, fish, nuts, and plenty of fruits and vegetables, has been linked to a lower risk of heart disease and better blood circulation. This is important because healthy blood flow is critical for achieving and maintaining an erection. A diet high in antioxidants, found in foods like berries, nuts, and leafy greens, helps combat oxidative stress, which can impair blood vessel function and circulation. Getting enough sleep is another often overlooked aspect of managing ED. Sleep is vital for maintaining testosterone levels, which naturally decline with age. Poor sleep or sleep disorders like sleep apnea can further contribute to erectile difficulties. Ensuring that you get enough rest each night is essential for maintaining not only sexual health, but also overall well-being. Aim for 7 to 8 hours of quality sleep each night to support your body's natural processes, including hormone production and tissue repair. Stress management is also key. Chronic stress increases cortisol levels, which can interfere with hormone production and affect blood flow, both of which can exacerbate ED. Finding effective ways to manage stress is crucial for improving sexual health. Techniques like deep breathing, meditation, or yoga can help reduce stress and promote relaxation. Even simple activities like spending time in nature or listening to calming music can help lower stress levels and improve overall mental health. Let's look at Tom, a 68-year-old retired engineer, as an example. Tom had been struggling with ED for a while and decided to take action. He started with simple exercises like walking and swimming, which helped improve his cardiovascular health. He also made changes to his diet, incorporating more fruits, vegetables, and healthy fats. After a few months of consistent exercise and better eating habits, Tom noticed a significant improvement in his energy levels, and his ED symptoms were much less frequent. With these positive changes, Tom not only improved his sexual health, but also felt healthier and more confident overall. Now that we've covered some lifestyle solutions to help with ED, let's dive into the emotional and relationship aspects, which also play a critical role in sexual health. When dealing with erectile dysfunction, ED, the emotional and relationship aspects are just as important as the physical ones. One of the most significant challenges that men face is the strain ED can put on their relationship. Open communication with a partner is essential to navigating this challenge. Discussing the issue honestly can help alleviate feelings of embarrassment or shame. It's important to remember that ED isn't a reflection of a partner's attractiveness or worth. It's a medical condition that can affect many men as they age. Starting a conversation with your partner might feel difficult, but it can lead to understanding and a stronger emotional connection. You might start by saying something like, "I've been having some difficulties lately, and I want us to work through it together." This approach can foster a sense of teamwork and reassurance. Managing expectations is another key factor. ED can lead to frustration, but it's important to have realistic expectations about intimacy and sexual performance. It's helpful for both partners to understand that while physical intimacy is important, it's not the only way to connect. Being patient and allowing space for non-sexual forms of affection can help strengthen the bond. For example, cuddling, sharing a meal, or spending time together without the pressure of sex can foster emotional intimacy and maintain closeness in the relationship. Understanding that intimacy can take many forms helps reduce performance anxiety and builds trust. Beyond communication and expectations, seeking support from others can be invaluable. Support groups are available throughout the U.S. where individuals can connect with others facing similar challenges. These groups provide a safe environment to share experiences, gain emotional support, and receive advice from peers who truly understand what you're going through. Many men find that talking to others who are facing similar difficulties helps them feel less isolated and more empowered to take control of their health. Counseling is another valuable resource, especially for couples. Therapy, whether individual or as a couple, can help address the emotional side of ED. Cognitive behavioral therapy, CBT, is often used to help men manage the anxiety, depression, or stress that can come with ED. Many people also turn to sex therapy, where they can discuss their concerns in a non-judgmental setting. For seniors, it's reassuring to know that Medicare may cover some counseling services, including therapy for mental health or relationship support, making it more accessible for those in need. Take Mary and James, for example. Mary and James are a couple in their late 60s who have been married for over 40 years. When James began experiencing ED, it initially caused some tension and frustration in their relationship. However, instead of letting the issue drive a wedge between them, they chose to address it together. They started by openly discussing their feelings and fears, and this created a space of understanding. Over time, they worked with a therapist who helped them focus on emotional intimacy and non-sexual forms of connection. As a result, not only did their sexual relationship improve, but they also found themselves feeling more emotionally connected than ever before. James credits their success to the fact that they didn't let ED define their relationship. Instead, they used it as an opportunity to grow closer. Now that we've explored the relationship and emotional aspects of dealing with ED, let's move on to some practical daily tips that can help improve your sexual health. Incorporating a few simple daily habits can make a big difference when managing erectile dysfunction, ED. One of the best places to start is with your morning routine. A consistent morning routine can set the tone for the day and help improve overall health. Begin by drinking a glass of water to stay hydrated, as dehydration can affect blood flow. Follow up with a light stretching session or a short walk to get your blood circulating. Morning exercises like yoga or deep breathing exercises can also reduce stress and improve overall circulation, which is essential for sexual health. Natural supplements, many of which are FDA approved, can also play a role in improving erectile function. Supplements such as L-arginine, ginseng, and zinc are often used to promote better circulation and enhance sexual performance. However, it's important to consult with your healthcare provider before starting any new supplements to ensure they're safe and appropriate for your health condition. Certain activities can also hinder your progress with ED, so it's crucial to be mindful of them. For instance, smoking and excessive alcohol consumption can impair blood flow, making it more difficult to achieve and maintain an erection. Reducing or eliminating these habits can significantly improve sexual health. Additionally, excessive stress or lack of sleep can worsen ED, so prioritize relaxation and rest to help improve both physical and emotional well-being. Involving your partner in the process can be incredibly helpful as well. Try setting aside time each day for intimacy without the pressure of sex. Activities like giving each other massages, holding hands, or simply talking can strengthen the bond and reduce performance anxiety. In terms of exercise, simple activities like brisk walking, swimming, or light strength training can boost circulation, improve stamina, and support better overall health. These small changes, when combined, can lead to lasting improvements in both your physical and emotional well-being. Now that you have some practical tips for your daily routine, let's summarize what we've learned and explore next steps in managing ED. In conclusion, it's important to remember that erectile dysfunction is not something to be ashamed of. It's a common issue, and with the right approach, it's manageable. By incorporating simple lifestyle changes, seeking medical advice, and communicating openly with your partner, you can regain confidence and improve your sexual health. Remember, small steps today can lead to significant improvements tomorrow. If you're struggling, don't hesitate to reach out to your doctor for guidance. There are resources and support available to help you. Stay hopeful, take action, and embrace the journey to better health. For more information, check out the links in the description.